Hi guys, this is AG with nursingforall.com, and today in this e-course I'm going to talk to you about how to study med-surg nursing using the 6 questions method. Now, you're like, what in the world is the 6 questions method? Well, this is a method that I basically came up with, and it's not a very complicated method. It is literally asking yourself 6 very common questions about disease processes that actually helps you understand the material, and not only understand it, but it's going to also help you be able to critically think and answer questions in your classroom setting. All right, guys, so before we jump into this actual e-course, I just want to tell you a little bit about myself. I am the Department Chair of Practical Nursing at Antonelli College. I'm also an instructor and instructor trainer for Hurst Review Services, which is an NCLEX review company, and we travel all over the United States and in Canada teaching nursing students how to pass their licensure exam on the first try. I'm also the founder and creator of nursingforall.com, which is a nursing and lifestyle blog. And as you can also see in that picture there, I am a mom and a wife, and that's my family, and they're really, really silly. So let's jump into this e-course now. All right, so one of the first things we're going to talk about is what exactly is hard or easy about med-surg. Now, for some students, this is different, and so this is going to be based on the individual. Some people think that foundations of nursing is actually harder than your med-surg or adult health content, and it really, again, just depends on you. For most people, though, they're going to find med-surg to be probably a little bit difficult. And here are some reasons why it's a little bit difficult. First of all, there is so much going on. Okay, so in foundations, there's really nothing happening. Is that you're basically learning the basic structure and function of body parts. You're also learning common skills that you're going to have to use in nursing. There's not that much going on in foundations, but when you get to med-surg, there's a whole lot going on. And so not only are you going to have to know what is common about body parts and their structure and their function, you're going to have to know what's going on when something's wrong with these body parts as well. So it's just a lot of information. In order to answer questions correctly, you're going to have to utilize critical thinking. And the problem with that is that there is no book that teaches you how to critically think. So you're going to have to really use your judgment to figure out exactly what to do. And sometimes we already know that we don't have the best judgment, and we also don't have the best critical thinking skills sometimes while we're in nursing school. And that's just something we have to practice. All right. Also, knowing definitions doesn't help you much here because, again, remember, this is moving past what something is. It's not only just what it is, it's how do we fix it? Why is it happening? And so that's just, more than just knowing common knowledge of what something is. Okay, going a little deeper into that, knowing what, but not why or how is not going to help you much. So again, you've got to ask yourself a few more questions here. You also have to be able to apply what you do know to numerous situations. Okay, so they can take one topic and put you in multiple situations, and the answer is going to be different. So you're going to have to know what to do in many situations. And then again, what's also easy or hard, depending on how you look at it, is there's something actually happening in med-surg nursing. There's an action that is happening, and it's going to require a reaction from the nurse. Versus if you were in foundations of nursing, usually there is nothing going on. There usually is no action that requires a reaction from you. They just want to know, do you know what this is and what it does? And so in med-surg, you're going to have to get much more detailed. All right, so how do we tackle this? Okay, so we're going to use the 6 questions method. All right, so the very first thing you're going to do is you're going to look at each disorder or disease process as a system first, okay, before you ever look at it individually. And all I mean by this is that, for example, instead of looking at hypertension, okay, when you're going to see that we're going to use hypertension a lot as an example throughout this entire presentation, just to show you how it works. But instead of like looking at hypertension first, I want you to look at cardiac. Okay, cardiac as a whole. Because here's the deal, is that usually when one thing gets messed up, the whole thing usually gets messed up. So for example, we already know that hypertension is going to first affect my heart, and then it's going to affect a whole bunch of other things. Well, it's not just hypertension that's going to mess my heart up. It's the fact that if I do have hypertension, my heart's probably going to be messed up, and the entire cardiac system is going to be messed up. So you might want to look at the entire system first and understand the system. Understand what's normal first. All right, and then also when looking at each disorder or disease process, you're going to ask yourself 6 questions. Okay, and again, these are the basic 6 questions that you learn when you're in elementary school. And these are the questions that when you're asking these things, they give you an answer. Okay, so for example, you're going to ask who, what, when, where, why, and how. And we're going to talk about each one of these individually. Now, if you can answer these 6 questions, that basically is going to give you a lot of information, and that means you know a whole lot about this topic. And what this does is it gives you an increased chance to do really well on your exam. And that's the whole goal, okay? We're just trying to do great in school. So if you can answer these questions, then you know a lot of information about medical surgical knowledge. All right, guys. So our first question that we have here is the who. So if we're using the 6 questions method, we're going to ask ourselves, who is more likely to develop this disease process? And so all this focuses on is who is most at risk and who's most likely to develop the disease process. So an example I have there for you is, does it affect men more than it affects women? Or does it affect infants more than adolescents? Or do we see this in our elderly client versus our more young client? It just depends on what's going on. And so if we use hypertension as our example here, then the truth is that for NCLEX purposes, and remember that's what we're always looking at, we're looking at how do we look at nursing care, is that there's really it's an equal field between men and women, is that there's really not that big of a difference between men versus women. Now, we also know that, of course, the older you are, the more at risk you are for developing hypertension. So I'm more than likely not going to see this as much in my infant or adolescent unless something else is going on. But the key thing here is that smokers. Hey, if the client is a smoker, then they're more at risk no matter if they're a woman, a man, or what, they're more at risk to develop hypertension. So I'm going to be worried more about my smokers here. Okay, so the what is the next question. And again, guys, just remember you can ask these questions in a more appropriate order if you would like to. I just listed them in the order that's most commonly known when you learn what questions are. Okay, so the what, this focuses on the definition of the disorder. So for some people, this is going to be the really easy question because this can be as simple as what the textbook definition says it is. And although you're not going to more than likely be tested on what something is, because that's a very simple question, in order to answer those harder questions, you got to know what something is. Okay, you got to start with the basics and then move yourself forward. Okay, so in order to really understand what hypertension is, you first have to kind of understand what is even causing the hypertension. So you really need to know what the definition of blood pressure is first. Okay, and we know that that's the force of the blood being exerted by the pressure against the vessel walls. So we know that what blood pressure is. Well, then in order to understand what hypertension is, I got to understand that, hey, that blood pressure must be too high. And so all you have to do is look at your textbook and find out what the definition of this disease process is. And so this one's the one that most people don't have trouble with. All right, the when. Now, the cool thing about the when question is that if you already kind of know your who, you may have a very good understanding of your when, but not all the time, but a lot of the time. Okay, so this question is just focusing on the timeline that the disease process is most likely to occur. And so some examples there. Is this occurring during pregnancy? Is it happening during menopause? Does it happen during childhood, etc.? And so you can put all kinds of factors in this question and come up with a when. Now, the thing is that with hypertension, we've already answered this question, is that we said that it's really more common in your elderly clients. So this is occurring more likely in adulthood. And yes, it can happen in childhood or youth. It just depends on if there's other factors going on. But this disease process is more than likely to occur in middle adulthood to our elderly client. We already said it's more common in our smoker. But then also, you see down there, I specifically put pregnancy as one of the examples because you already know with hypertension that you can have pregnancy-induced hypertension, which kind of changes the definition just a little bit. But that's just an example to let you know that you might want to ask these things or research these factors when you're trying to discover your when. All right, guys, so the where. All right, now this question really focuses on physical locations. Okay, so it wants to know the physical location that the disease process is going to affect. And then other locations that may see residual effects. All right, so example, is this happening in the heart? Is it happening on the skin? Is it happening in the lungs or kidneys? And the cool thing about this one is that it can get as specific as you want it to be. And the more specific you can get it, the more in-depth knowledge you actually have. So if you know something's actually happening with the heart, well, what part of the heart? Okay, so if the client needs a pacemaker, then that's the SA node. Okay, if the client's got something going on with the functioning of breathing, then it may be happening in the alveoli. Are they completely open? Are they closed? And then it could also be happening in the temporal lobe, okay, so of the brain. So it just depends on what are you talking about and where is it happening. And again, the more specific you can get it, the more in-depth knowledge you're going to actually have. Now, if we're talking about hypertension, then of course we already know then that's more than likely got something to do with my heart. But remember that sometimes it doesn't necessarily have to do with the heart. Maybe it's the kidneys. Okay, maybe the kidneys are not functioning well, and that's what's causing the hypertension. So you just have to know where are all the wheres. Now, the other thing about hypertension is that if a client has long-term hypertension, if they've been having hypertension for a while and it's untreated or undiagnosed, then they may start having those long-term residual effects where you're starting to see lots of systemic changes. And so they may start having signs and symptoms in other places of the body just because they've been having hypertension for an extended period of time. So just know that this can kind of get in depth, but the more in depth you make it, the better you know. Okay, the more you know. Okay, guys, the why. And guys, the why is the big one. Okay, this is the big question. This is really focusing on the purpose, okay, of the disease process or the purpose of the disorder happening. Okay, so literally it's just ask that question, but why? Okay, but why is this happening? I know what it is, but why? Why is it happening? Now, some textbooks, this is easy to find usually in your textbook because most textbooks specifically headline this. They usually either label it as etiology or the pathophysiology. And sometimes I guess this just depends on the area of the country you're in or where your textbook was published. But most textbooks have it labeled as pathophysiology. So the example is hypertension occurs when, okay, when da 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 da. Okay, so whatever is occurring is going to be listed there. And guys, this can get really in depth sometimes. Sometimes they use lots of words and lots of abbreviations that you may not know the meaning to. So suggestion here is that if you come across a word that you don't know, look it up. Okay, you got a Tabor's dictionary. or any medical dictionary that you may be using, look those words up to find out what they mean, because sometimes they do. They use words and phrases and abbreviations that you just don't know what they mean. Okay, so this can get really, really in depth. But the funny thing is that this is the important question. This is the question of all questions, except there's one more question that's just as equally as important to me, and we're going to talk about it in just a second. But the why question is one of the most important questions you can know. Okay, so just spend a lot of time trying to make sure that you know your why. Okay, guys, the other big question, the how. All right, now I think this question is so important because once you've figured out everything, okay, you know what it is and why it occurs and when it occurs and all those other questions you ask, is that we want to know, how do you fix it? Okay, how does the nurse do something about this now? And your instructors really need to know that you know what to do. Okay, you know what to do as the nurse to help fix the problem or fix this disease process. And so this is a question that you really need to focus on. Okay, so this question is focusing on what the nurse plans to do to treat the disease process. Now, this can be based on primary healthcare providers' orders. Okay, so you're going to be following a set of orders, some nursing considerations, so some things that you as the nurse would consider, and or interventions that you may want to implement or need to implement. So here's some examples. Okay, maybe I should monitor the blood pressure. I could administer some medication, or maybe I need to perform diversional activities. Okay, etc. And these again are specific to whatever disease process you are trying to treat. So for example, of course, with hypertension, of course I want to monitor the client's blood pressure because that's going to let me know if any of the other treatments that I've been doing have been effective, or is the client's blood pressure getting better, or is it getting worse. Then of course I could administer medication depending on the primary healthcare provider's orders. Maybe this client's going to be on a beta blocker. And remember, your beta blockers end in LOL. Okay, these of course are going to lower the client's blood pressure, and they have some other good effects for my client. But that's the main goal here, is I want to get this client's blood pressure under control. So I could do that. And then there's a list of other things. Maybe I need to get some lab work, because remember I said that the client may not be necessarily having a problem with their heart. Maybe they've got kidney issues. So I want to get some lab work to check all of their labs to see if that can possibly let me know what's going on with the client. Again, based on the primary healthcare provider's orders. And so you're going to check those and see what you need to do to figure out what you can do to fix this client's issue. Now the how, again, can get really in depth, just like any other thing can get in depth. But if you know what you're going to do, that's great, because remember, a lot of questions focus on the nurse being active. What is the nurse going to do? All right, guys, and so that's it. We've discussed the 6 questions. I really hope that you found this helpful. I do want to just leave you with one little tip. I always let people know and students know that if I ever talk about something like this really is not NCLEX specific. Guys, this is really just something that I teach our students to do in the classroom to be able to better their scores on their exams in their class. If you are looking for some NCLEX help, I am always going to recommend that you take a awesome NCLEX review. A great one I will recommend is always Hurst Review. Okay, take the Hurst Review or any NCLEX review of your choosing, but you really need an NCLEX review. If you're focusing on NCLEX. Again, my stuff is just always classroom specific, just to help those students in the classroom. I would love for you guys to connect with me. We like to give you updates, and I always host giveaways and more. So I want you to subscribe to this channel. Okay, so please subscribe to my YouTube channel. Subscribe to my blog. Okay, the blog is at www.nursingforall.com. You can follow me on Instagram. We talk about lots of fun things there. I post lots of cool pictures and things there at AG Nursing for All is the Instagram handle. And then please like and follow the Facebook page for Nursing for All. And all you have to do, of course, is put Nursing for All in the search bar and you'll find me. All right, guys, so as always, I hope you have a good one, and hit me up if you have any questions or need to talk about anything. All right, so guys, have a great day and great best of luck in nursing school. Peace out, players.